guys, and welcome back to my channel. So today is well overdue. I am starting my first series of, I guess, the physical therapy education module, okay? So today, well, the next couple days will be focused on spinal cord injury. So I decided to choose this topic not only because it's coming up on my finals and I need to review, but I feel as though everyone is going to encounter someone who has this condition at least once in their life. If it affects you, if it affects your family, or if it's just someone in your environment, I feel as though all of us just needs to be more educated about this topic. So I'm actually going to produce 4 videos to help you understand this condition more. The first one, which is this one right here, is going to focus on what spinal cord injury actually is. And then the second one are going to be like a myth busters. So basically, before learning about spinal cord injury, there were a lot of things that I was ignorant to, that I didn't know that the population could do. So I want to inform y'all as well. So that's going to be the second video. Then the third video is basic disability and spinal cord injury. I can't talk. Basic disability and spinal cord injury etiquette. So even though you might not encounter someone with a spinal cord injury on your everyday life, I feel as though you just need to know these simple things, because you might think that you're trying to be nice, you might think that you're trying to help, but sometimes it could be insulting to some people. So I'm gonna produce a video about etiquette. That's gonna be my third one. And then my final one is I have an assignment that I have to I don't want to say pretend, but I basically have to live the life if I had a spinal cord injury. I get to pick my level. Basically, we get to pick like T something to L something, T4. We can pick it basically. And I'm going to be in a wheelchair all day, and I'm going to do basic challenges. So transferring into a car, going to a bar, going shopping, going to a restaurant, things like that. That's what I'm going to be covering in my video. So I feel like that should be, I don't want to say fun, but informative, and to give insight, even though I can't even imagine, but just to give an insight of the daily struggles of someone who has to be in a wheelchair, just to see how things can go, okay? So let's get into this video. So this video is going to be a basics of what spinal cord injury is. I'm not going to give y'all too much anatomy at all. It's going to be very basic, what everyone just should know about spinal cord injury, okay? So just some statistics first. In the US, there's about 288,000 people with spinal cord injury, and about 78% of those cases are males actually. So males, we have that, well, it's not like a perception, it's actually, there's facts that males tend to take more risk, more in sports and stuff like that. So they're at more risk for a spinal cord injury. So some causes for spinal cord injury are usually traumatic, but they don't have to be accidental. The leading cause for spinal cord injury is motor vehicle accidents, which is followed by falls, and then sports, and the number one sport would be football for spinal cord injury. Diving is another cause, but that has actually decreased since we had campaigns as feet first instead of head. So diving head, and you hit your head, that can go into spinal cord injury. Some non-accidental causes would be cancer, MS, inflammation, stuff like that. Inflammation of the spinal cord, let me get that right, stuff like that. So those are some non-accidental causes that could cause a spinal injury. So what actually happens? So basically, our spinal cord is a communication between our body and our brain. And when that's disrupted, the spinal cord is very fragile. So when that's disrupted, there's paralysis, which is like loss of function and sensation, or paresis, which is just weakness. Depending on your level, there's going to be different signs and symptoms, okay? So basically, kind of like a rule is the higher the spinal cord injury is, the more dysfunction that you will have. So let me just say, for instance, like someone who is a C4 complete spinal injury, they will only have shoulder elevation and face and neck muscles. So they can swallow, they can talk, they can chew, they can shrug their shoulders, stuff like that. They can breathe, but they will have breathing problems because they don't have their abdomen and stuff like that. They'll use like accessory muscles to breathe. And as physical therapists, we can teach them different types of breathing and different techniques, but that's a whole different video, okay? So basically each level that we have is associated with a muscle action, which could be like shoulder elevation, and like a sensation. So basically, can you feel that? Those kind of things. So yeah, some terms that you might hear out or associated with spinal cord injury. The first is complete. So like prior, I said that the patient was a C4 complete spinal cord injury. So complete basically is that you have no sensory or motor below your level of injury, okay? So there's another thing that's characterized by complete. So that basically is called non-sacral sparing. So basically is that you don't have any bladder or bowel function, okay? So you won't be able to do any of those functions, which is unfortunate, but that's what happens with a complete injury. And that's basically how you characterize a complete injury. And you would do an anal exam to know that's true, okay? So the next thing is called incomplete. So incomplete is basically the opposite of complete, and that's when you have sensory motor, some sensory motor below your level of injury. And those have the potential of regaining some motion back. And those, a really frustrating thing that some patients can deal with is that spinal cord injury is so relative to the patient. Everyone's experience is different, especially if you're an incomplete spinal cord injury. Some people can get back to walking, some might not. And as physical therapists, it's kind of hard to give someone that hope or take that hope away from someone because we don't know. We can only do the best that we can, and then your body takes over the rest, okay? So, and then the last two terms we're going to teach y'all are tetraplegia. So tetraplegia is basically like we were talking about before, those high level spinal cord injury, and that's when they don't have any function of any of their extremities. So they don't have any arm or leg function. And then paraplegia is basically when they have their upper extremity and they don't have any function. They may, depending on their level, they might not have trunk or leg. So function, motor function, sensory, anything like that. So yeah. So yeah, guys, I hope this video helped. Though that is my basic knowledge for spinal cord injury that I want to give y'all. Those are just some terms and things that you should know about spinal cord injury to help, you know, just be more aware of this, okay? So I can't wait to see y'all in the next video. Bye.